So today we're going to be talking about turf toe. So a few weeks ago, Jayden Reed, who's wide receiver for the Green Bay Packers, suffered this particular injury after receiving a pass. And so I want to talk a little bit more about what turf toe is, how we manage it, and just some points for consideration to try to prevent this particular injury from occurring. And so, funny story, this is actually my wife's favorite diagnosis for whatever reason. Anytime we're watching football, we hear about somebody with a foot or ankle injury, she automatically just assumes that they have turf toe. Not really sure she knows what it is, so hopefully this will help her and you guys out as well. So when we look at the bottom of your bottom of your foot actually has a piece of ligamentous tissue called your plantar plate, and it serves as just kind of like an extra row of support for the ball of your foot, and that's typically needed for when you're running, planting, pivoting, twisting, things like that. So that's typically why we see turf toe in sports like football, rugby, lacrosse, and soccer as well, just because of the amount of pivoting and twisting that they need to do out on the field. And so what happens in turf toe is basically there's some type of injury or disruption to that plantar plate. Now that plantar plate runs across the entire row of the ball of your foot, but typically it's the part of your big toe that's injured, because that's involved mostly when we think about toeing off when we run, when we plant, or when we twist. A lot of pressure is placed more so on the big toe than the other parts of the ball of your foot or the other parts of your toes. So a turf toe injury occurs when the athlete's toes are extended backwards. When that toe extension occurs, that really pulls on and disrupts the bottom bar, that plantar plate of their toes. And again, we talked about how the big toe is typically involved because that's the one that has the most pressure with planting and twisting and running. And so it's termed turf toe because, like the name implies, it's more heavily involved with sports that are played on artificial turf. The theory is that the artificial turf can actually increase the purchase or the grip of the bottom of your foot while you're out on artificial turf as opposed to grass. And often artificial turf is a little bit harder, so more disruptions likely to occur. So athletes who suffer from turf toe will oftentimes complain of pain along the bottom of their first toe, and they'll say that it really hurts when they go to push off when they run. Sometimes when they walk, depending on how bad the injury is. We grade the turf toe injury on a scale of 1, 2, or 3, and grade 3 is when we have a complete rupture or blowout of the bottom of the plantar plate. That's pretty rare. It does occur in contact collision sports, but most of the athletes that have a turf toe injury have more of the lower grades on grade 1 or 2, where there's some mild disruption of that plantar plate. So oftentimes it's more heavily involved when they go to do their particular sport and the demands of their particular activity, like running and pivoting and twisting and things like that, and occasionally jumping. And so a lot of times, the athlete will want to try to stretch out the bottom of their foot, and that is definitely the wrong thing to do, because as you stretch out that big toe, that's going to further put pressure on the bottom of the toe and the bottom of that plantar plate. That's going to make the injury worse. So what are some of the things that we can do to help these athletes that do sustain a turf toe injury? So, there's a couple different taping techniques that exist out there, but at the end of the day, what we really want to do is we want to limit the amount of big toe extension, which is when that big toe gets pulled back. And so we can do that by talking to them about not going barefoot, wearing shoes that are hard soled. And then the other thing that we can do is we can strengthen the bottom of the foot, because when your big toe is really irritated, the gripper muscles on the bottom of your foot will sometimes also be aggravated as well. And so we're trying to offload the big toe, and we can try to do that by activating more of the intrinsics or those gripper muscles on the bottom of the foot. So the other thing we need to think about when we talk about somebody with a big toe or turf toe injury is their ankle mobility. So we're talking about the ability of the shin or the knee to cross in front of or towards the toes. If somebody has really poor ankle mobility, when they go to walk or run or pivot, what's going to happen is if they run out of room on that shin where their ankle mobility is, then extra pressure is going to go more towards the front of their foot, especially that big toe and that plantar plate, which can lead to a lot of chronic overuse style injury of that plantar plate or turf toe. And so it's really important that when we have somebody with turf toe that we're working on and addressing some of those ankle mobility restrictions, because that will really take a lot of pressure off of the injured big toe. And the other thing is that it's really important to have somebody to screen the athletes prior to the season starting for those who participate in a lot of running, pivoting, jumping sports, because we can try to get ahead of and potentially prevent or minimize the risk of somebody injuring their big toe, the bottom of their foot, their heel, and some other ankle injuries. So injury risk reduction strategies by the use of preseason screens is really huge.